Good evening and thanks for joining us tonight. I'm Martha Koloski.
And I'm Mike Thompson. Healthcare reform has been a battle down the aisle, splitting Republicans and Democrats as they work to find the elusive common ground.
As politicians argue about what should or should not be in the reform bill, the people are left wondering what's going to change for me. News Channel 8's Cynthia Schweigert now joins us live in the studio, new at 10, with some of the answers to those questions. Cynthia?
Well, Mike and Martha, healthcare reform can be confusing and overwhelming, leaving people in our area with a lot of questions. Now, to find the answers, we talked to the CEOs of Franciscan Skemp and Gunderson Lutheran. Each has been closely following both sides of the debate. Let's start with the most basic question. What is healthcare reform? It can encompass many different ideas, but lawmakers are focusing their efforts.
What is health reform all about? It's getting more people into some form of coverage for their health insurance expenses, either public or private.
And that begs the question,
how can I get health care and how can it be affordable?
What the government intends is what's called a health insurance exchange. If your pay and benefits are below the 400% of the poverty level in the country, you would receive a sliding scale subsidy to enroll and get health care from the exchange.
That means the closer you are to the poverty line, the more government money you'd get to pay for insurance. But insurance wouldn't just change for individuals.
And how's it going to affect us as in the business world?
The way the proposal is in the House plan right now, there's a great potential that many of the employers would not stay in the insurance providing business, and therefore a lot of people would change.
Dr. Nesi says right now there's a gap between what a procedure costs and how much Medicare pays for it. He says that income loss is made up by private businesses. And while nothing is set in stone yet, he says the proposed reform could help close that gap.
We lose about 30 cents on every dollar of our costs to underpayment for the government. We shift that to private business. Making the Medicare payment fair would actually, in my opinion, decrease the pressure for cost shifting, and that could be a direct improvement to business. So that's one thing that would be positive. What would be negative for business potentially? If insurance changes and there isn't very broad participation by the population and only sick people sign up for it, the fact that insurance has to be issued to everybody, you couldn't cancel folks, could make insurance more expensive for the businesses.
With these possible changes, people are wondering what kind of coverage they could end up with.
What about, and like about mental health care, is that going to be covered also, or is it just going to be what we consider normal health care? Or also like dental, is that going to be covered also?
A basic health plan that would be required of any insurance company that wishes to participate in a public, what they would call the public exchange. That plan, I believe, would not automatically include dental or eyeglass coverage and some of the other things, because those would raise costs.
Well, like anyone, Dr. Nesi and Dr. Thompson do have their own opinions on healthcare reform, and the government has used both institutions as examples of what's working in the current healthcare system. Now, we know that there are still a lot of questions out there about all of this. We'll work to answer some more of those tomorrow night. In the meantime, people can feel free to email or send me a message on Twitter if they have any questions about healthcare reform.
Yeah, it's just really because it's changing so frequently, it's hard for people to keep up.
Right, and it's still so broad. There's a lot of what ifs right now still, so we're working to kind of pare some of those down and get some more information out there.
All right, thanks so much, Cynthia. Also, the final part of our special series, Getting to the Heart of Healthcare, airs tomorrow night at 10, so if you've missed any of the previous parts, those stories are posted on our website.
And we have an update on last night's Getting to the Heart of Healthcare story. We told you about Dave Wester, who has leukemia, and even though a life-saving transplant was listed in his insurance policy, it was initially denied by his insurer. Well, Wester fought the system and eventually got the procedure covered. Wester emailed us today to let us know his policy has been updated for next year, and the type of treatment he's getting now will no longer be included in the plan starting January 1st. Wester says it won't affect him, but any other person that needs a transplant in the future will find that it's not covered. And Wester also says his insurance premium is increasing almost $120 a month.